Hello. The title of this video is How to Lower Blood Pressure in 24 Hours. This sounds like a sensational, even an irresponsible claim. And I must be unequivocally clear from the start. We are not discussing a cure for a chronic, complex condition in one day. But what we are going to do is far more powerful. We are going to conduct a biochemical demonstration. We are going to illustrate a profound principle, that your blood pressure is not a fixed, static number. It is a dynamic, minute-by-minute response to the hormonal instructions you are giving your body. My name is Professor Marcus Fischer. My work is to investigate the root cause, not to chase the symptom. And for decades, the medical establishment has been relentlessly focused on one symptom: salt. You've been told to fight a war on salt. You've dutifully cut it from your diet, and yet, for many of you, your pressure has barely budged. Today, I will explain why. You have been fighting the wrong enemy. The true culprit, the master regulator of your blood pressure, is a hormone, and that hormone is insulin. Part 2. The real villain, how insulin controls your blood pressure. To understand this, we must look at one of the most elegant and misunderstood organs in your body, your kidneys. Your kidneys are the master chemists of your bloodstream. They filter your blood and make constant life or death decisions about what to keep and what to excrete. Their most famous job is managing your sodium and fluid balance. Here is the mechanism that is almost never discussed. One of the primary jobs of the hormone insulin is to talk to your kidneys. And when insulin levels are high, it gives your kidneys one very clear command: hold on to sodium. Do not let it go. Think of your kidneys as the gateway for sodium to leave your body. Insulin is the guard at that gate. In a person with a healthy metabolism, you eat a meal, insulin rises, it tells the kidneys to hold on to some sodium, and then it quickly falls. The guard goes on break, and the excess sodium is released. The system is in perfect balance, but what happens in insulin resistance? This is the condition, as we've discussed, where a diet high in sugar and refined carbs has forced your body to produce massive amounts of insulin all day long. You are living in a state of chronic high insulin. This means the guard at your kidney's gate never leaves his post. He is under 24/7 orders to hold all sodium. You could be on the strictest, most flavorless low-salt diet in the world, but the tiny amount of sodium you do consume is being captured and held onto with an iron grip. This retained sodium forces your body to retain water to dilute it. This excess water expands your blood volume. More fluid in a closed system, your blood vessels, equals higher pressure. This is the root cause. Your high blood pressure is not a salt problem. It is a symptom of a waterlogging problem, which is driven by a sodium retention problem, which is caused by a high insulin problem. Part 3. The vicious cycle: arterial stiffness and mineral imbalance. This high insulin state creates a second devastating problem. It creates inflammation and makes your blood vessels stiff. Your blood vessels are not lead pipes. They are supposed to be active, pliable, muscular tubes that can widen and relax to accommodate blood flow. But chronic high insulin is a pro-inflammatory signal. It contributes to the hardening of the arteries, or atherosclerosis. Now you have two problems: a higher volume of fluid in your pipes, and pipes that have become stiff and can no longer relax. This is a recipe for cardiovascular disaster. But there is a third tragic component. This is the mineral imbalance. While high insulin tells your kidneys to hold on to sodium, it has the exact opposite effect on two other critical minerals: potassium and magnesium. High insulin and high blood sugar cause your kidneys to actively waste and flush out your body's supply of potassium and magnesium. This creates a vicious, perfect storm. You are low on potassium, the mineral that counters sodium and helps relax your blood vessels. You are low on magnesium, the master relaxation mineral that is essential for preventing muscle spasms and keeping your artery walls soft and pliable. You are high on sodium, or rather, retaining it, which holds the excess water. Your body is now biochemically programmed for high blood pressure. You are tense, stiff, and waterlogged, and no amount of salt restriction will fix this underlying hormonal and mineral imbalance. Part 4. The 24-hour experiment. A demonstration of principle. Now let's return to the 24-hour premise. How could we demonstrate to ourselves that this insulin mineral mechanism is the true driver? We would have to design an experiment that accomplishes two things very, very rapidly. Crash our insulin levels to as close to zero as possible. Flood our body with the minerals we are deficient in, specifically potassium and magnesium. Before I continue, I must repeat my warning. This is a scientific demonstration for educational purposes. You must not attempt this if you are on any medication, especially blood pressure medication or diuretics, or if you have any kidney disease, as a rapid shift in blood pressure or electrolytes can be extremely dangerous. This is a protocol to be discussed with your physician. Here is what the 24-hour protocol would look like. The goal: send the opposite signal. The opposite of a high insulin, low potassium diet is a zero insulin, high potassium diet. The method: for a 24-hour period, you would do two things. First, you would fast. You would consume nothing but water, herbal tea, and perhaps some black coffee. This is the single fastest way to drop your insulin levels. When insulin plummets, the guard at the kidney's gate finally walks away. Second, you would flood your body with potassium and magnesium. You would not do this with food, as that would raise insulin, even healthy food. You would do this by adding these electrolytes to your water. You would add a high-quality food-based potassium citrate, or cream of tartar, which is high in potassium, to your water, aiming for 3,000 to 4,000 milligrams spread throughout the day. You would also take a highly absorbable magnesium glycinate supplement. What would happen? When your body is in this fasted, low insulin, high potassium state, the kidneys instantly get a new set of instructions. The signal is: release the sodium. Your body will begin a powerful, natural diuretic process. You will excrete all of that retained sodium and the water that was attached to it. Simultaneously, the influx of potassium and magnesium will tell the walls of your blood vessels to relax. You are attacking the problem from both ends. You are decreasing the volume of fluid in your pipes, and you are relaxing the pipes themselves. People who do this, under medical supervision, are often shocked to find their blood pressure numbers significantly lower in just one day. They have proven the principle. They have proven that their blood pressure is a response, not a fixed state. Part 5. The long-term sustainable solution. That 24-hour fast is a powerful demonstration. It is not a sustainable long-term lifestyle. The real solution is to take those principles and build a life around them. The long-term cure is a low insulin, high potassium, high magnesium diet. What does this look like? You stop the high insulin foods: sugar, bread, pasta, rice, cereal, fruit juices, and all processed foods are the first to go. This is non-negotiable. You eat your potassium. You must get your 4,700 milligrams of potassium from food. This means a diet rich in avocados, salmon, spinach, Swiss chard, mushrooms, and other leafy greens. It means eating the 7-cup salad we have discussed. You eat your magnesium. You get this from leafy greens, nuts, seeds like pumpkin seeds, and high cacao dark chocolate. Many people will still need to supplement with magnesium glycinate to correct a chronic deficiency. You reevaluate salt. You will find that when your insulin is low and your potassium is high, your body becomes excellent at regulating sodium. You will no longer need to fear salt in the same way, and can use high-quality sea salt to taste. Your high blood pressure is a desperate signal from a body that is waterlogged and mineral-starved, all driven by a single hormone. Stop fighting the war on salt. Start fighting the war on insulin. Address the root cause. Thank you for your time. Please, this is one of the most serious topics we can discuss. Talk to your doctor. Use this information to have a more intelligent conversation about your health.